All right, so today we're going to be performing a lumbar puncture. We've got our mock patient here. There's two different orientations where you can do your lumbar puncture. You can do it upright, vertical, or as we have here on the side. The upright vertical position is historically a little bit easier to get. However, if you need to perform an opening pressure, you cannot perform it in that position. Typical landmarks on a patient, you measure the iliac crest, and then where that iliac crest, you draw a line down, and that should intersect with the L4 spinous process. And above that, you've got your L3, L4 interspace, and then your L4, L5 interspace that you can perform your procedure. So we're going to be palpating for our spinous processes here, and we find the spot that's in the middle, and we mark that. And I like to take the blunt end of the needle cap and make an indentation so that it sits in the skin. So that's my landmark for the procedure. We would use our iodine to clean the area. I really would do this first before draping. It just gives you a wider space to operate with, or a wider area to operate with. Then we drape the patient. We've got our landmark there. And then next up in this kit, we've got our lidocaine. So we've got 1% lidocaine, and I like to do a stepwise approach. So I create a little wheel on the skin at my target site. And then after I've created a wheel, I then upgrade needles, and I get to the longer needle. And this I inject. And this is a good test to see if your angle is right as well, to see if you hit bone as you go deep in to the skin. You don't want to go into the CSF area, but you want to anesthetize the deeper spaces. So you start anesthetizing and pull out, and if you didn't hit bone, you know you probably have the right trajectory. All right, so now we've got our patient all numb, and now we've got our spinal needle here. So it's very important, one, the bevel approach. You need to intersect the dura and the layers at a parallel point with the needle. This limits the amount of potential spinal headache and spinal leak. So if I'm in the horizontal position, my bevel needs to be upright. And then conversely, if I'm having it upright, it needs to be to the side if my patient position was upright. All right, so my bevel is up. And my control of my needle, I want to be like this. I want to have control deep, and I want to have control superficial with my thumb. So I'm making slow, calculated movements. And going back to the previous video where we dealt with the tactile feel, you're going to feel an initial pop after you get through the skin and adipose tissue, and that should be your supraspinous ligament. And then we're in the interspinous ligament, and then our final pop should be at the ligamentum flavum. And then we can start to remove our catheter here and see if we get any CSF. If you don't get CSF, you just replace the sheath, keep on advancing, and then potentially redirect if necessary. And there we've got our CSF fluid. So now we have the option, if we want to have our manometer set up here. We got our stopcock turned to off here, and we can check our opening pressure. The CSF is going to climb up this manometer here. And then if we want to then use the CSF here, we want to use this to fill our tubes. So we would just turn this off and have our tubes with an assistant ready to go to collect. It's a little complicated to do one-handed in this video, so I'll discontinue this. But where the bevel maxes out, that'll be your opening pressure. All right, so we've got our CSF, we've got our tubes labeled 1, 2, 3, and 4. We need about 5 drops of CSF, or about 2 cc's a piece. And we would just seal those off and keep going. Numerically 2, 3, and then finally at number 4. Once we get done there, I want to resheathe this before I pull out the needle. And then once again, I'm going to take a very controlled approach to pull out the needle. followed by a Band-Aid. And apply a little bit of pressure to get a clot going, and then the patient can lay on their back for 20 to 30 minutes. And that is how to perform a lumbar puncture. Feel free to look at the other videos to learn how to troubleshoot this procedure and what to expect, as well as the previous video as what to expect in your lumbar puncture kit. And that is how you do a lumbar puncture. Thank you guys for watching. Stay tuned for more.